Greetings to all our valued viewers watching Holistic Health 24H. We wish you a day full of health, peace, and joyful moments with your loved ones. In today's video, we'll explore a very common disease among the elderly, one that is often underestimated, type 2 diabetes. This condition is known as the silent killer because it develops quietly, with few noticeable symptoms, yet it can lead to extremely dangerous complications such as stroke, blindness, kidney failure, or even limb amputation if not detected and treated in time. Have you ever experienced prolonged fatigue, constant thirst, frequent urination at night, or unexplained weight loss? Don't ignore these signs. They could be early warning signals of type 2 diabetes that your body is silently sending you. So what exactly is type 2 diabetes? Who is most at risk? What are the warning signs? And most importantly, how can older adults effectively manage this condition and live a healthy, proactive life every day? All of this will be shared in today's video. If you've experienced symptoms related to diabetes, or have a loved one living with this condition, please leave a comment below to share your experience. Let's help each other and spread valuable knowledge to the community. 1. What is type 2 diabetes? Type 2 diabetes, also known as type 2 diabetes mellitus, is a very common metabolic disorder, especially in middle-aged and elderly people. Normally, after each meal, sugars from food are absorbed into the bloodstream. The pancreas then releases a hormone called insulin, which helps transport sugar from the blood into the cells to produce energy. However, in people with type 2 diabetes, the body still produces insulin, but it doesn't use it effectively. This condition is known as insulin resistance. As a result, sugar accumulates in the bloodstream instead of being properly processed. If this condition persists, high blood sugar levels gradually damage many vital organs such as the heart, kidneys, eyes, nerves, and blood vessels. Unlike type 1 diabetes, which typically develops in young people due to the body not producing insulin, type 2 diabetes progresses silently and often appears after the age of 40, especially in those over 60. Because the disease develops slowly and symptoms are often unclear, many people only discover they have it once serious complications have already occurred. Type 2 diabetes is not just a chronic disease, it is also a major risk factor for premature death if not properly managed. However, the good news is that this disease can be effectively controlled through a healthy lifestyle, proper medication use, and regular health monitoring. 2. Early warning signs. One of the reasons type 2 diabetes is so dangerous is because it progresses very silently, without causing clear pain or symptoms in the early stages. Many people only discover the disease once complications such as vision loss, nerve damage, or kidney failure have already developed. However, if we pay close attention, the body does send out early warning signs. Here are some symptoms that middle-aged and elderly people should watch out for. Frequent thirst, especially at night. A constant dry mouth and the need to drink water repeatedly, even waking up in the middle of the night to drink, may be due to high blood sugar levels, which cause the body to lose more water than usual. Frequent urination throughout the day. When blood sugar is high, the kidneys work harder to eliminate excess glucose through urine. As a result, people with diabetes often urinate frequently, even at night. Persistent fatigue despite not engaging in strenuous activity. Because glucose, the body's main energy source, is not effectively absorbed into the cells, individuals may feel sluggish, weak, and low on energy, even with adequate rest. Unexplained weight loss. Despite eating normally, or even more than usual, rapid weight loss may occur. This is a serious warning sign, as the body starts breaking down fat and muscle for energy in place of glucose. Slow healing wounds. Minor cuts, skin wounds, or foot and hand ulcers may take a long time to heal. This is due to high blood sugar affecting blood vessels and weakening the immune system. Blurred vision, itchy or easily infected skin. Reduced eyesight, blurry vision, especially in the evenings, along with dry, itchy skin, rashes, inflammation, or fungal infections, particularly in private areas, can all be signs of uncontrolled diabetes. If you or your loved one experiences one or more of these symptoms, do not delay. Visit a medical facility to have your blood sugar levels checked as soon as possible. Early detection not only allows for more effective treatment, but also helps prevent dangerous long-term complications. 3. Serious complications. Type 2 diabetes is not just a chronic condition, it is a silent trigger for a wide range of dangerous complications if not properly managed. Even more concerning, many of these complications are irreversible once they occur, and they have a direct impact on a patient's life expectancy, health, and overall quality of life. Here are the most common and alarming complications. Blood vessel damage, increased risk of stroke and heart attack. High blood sugar damages blood vessel walls, leading to atherosclerosis and blockages. This significantly raises the risk of stroke, heart attack, and other cardiovascular issues. In fact, cardiovascular disease is the leading cause of death in people with diabetes. Nerve damage, numbness, loss of sensation, and foot ulcers. High blood glucose levels harm the peripheral nerves, especially in the hands and feet. Patients may experience tingling, pain, numbness, or an inability to feel injuries, particularly on the feet. In severe cases, foot ulcers can become infected and non-healing, sometimes requiring amputation to save the patient's life. Retinal damage, blurred vision, visual impairment, or blindness. Prolonged diabetes affects the small blood vessels in the retina, leading to retinal bleeding and macular edema. Without timely treatment, this can result in permanent blindness. Kidney damage, chronic kidney disease requiring dialysis. The kidneys constantly filter the blood. Persistently high blood sugar damages the filtering units, gradually leading to kidney failure. This can cause swelling, fatigue, and the need for regular dialysis to survive. Infections, skin, mouth, and genital areas prone to infections. People with diabetes are more prone to bacterial and fungal infections due to a weakened immune system. Even minor cuts or scratches can develop into serious infections if not properly treated. All of these complications can severely affect a person's daily life, from personal hygiene and ability to work, to emotional well-being. That is why early detection and strict management of type 2 diabetes are absolutely crucial, ideally before complications have a chance to develop. 4. 6 Golden Rules for Effectively Managing Type 2 Diabetes. The good news is that although type 2 diabetes is a chronic condition, it can be effectively controlled if managed properly. Many elderly individuals live with diabetes and still enjoy good health and a happy life without serious complications, thanks to daily, proactive self-care. Here are 6 golden rules to help older adults manage type 2 diabetes effectively. 1. Follow a healthy diet and control intake of carbs and sugar. Diet is the most important factor in blood sugar control. Patients should limit high-carb foods like white rice, noodles, pho, and bread. Avoid sugary foods, soft drinks, sweets, desserts, and overly sweet fruits such as durian, jackfruit, and ripe mangoes. Increase intake of green vegetables and fiber-rich foods like bitter melon, leafy greens, zucchini, and oats. Eat smaller, more frequent meals, 4 to 5 times per day, on schedule, and avoid getting too hungry or too full. 2. Exercise regularly, according to your physical condition. Gentle physical activity improves insulin sensitivity and stabilizes blood sugar levels. Older adults should choose light exercises such as walking, slow cycling, gentle yoga, tai chi, or qigong. Exercise at least 30 minutes per day, split into morning and afternoon sessions if needed. Exercise within your limits, avoid overexertion, and don't exercise on an empty stomach or right after a heavy meal. 3. Monitor blood sugar levels regularly and keep records. Frequent at-home blood sugar testing is the best way to stay informed about your condition. Use a personal glucometer to check fasting blood sugar in the morning and again 2 hours after meals. Record your results daily and bring them to your doctor's appointments for better treatment adjustments. 4. Take medications exactly as prescribed. Many people stop taking medication when they feel better, or switch to herbal remedies based on hearsay. This can be very dangerous. Always take medication on time and at the correct dose, following your doctor's instructions. Never stop or adjust your medication without professional guidance. 5. Stay positive and get enough sleep. Chronic stress and anxiety can raise blood sugar levels. Keep a positive mindset and avoid negative thinking. Practice deep breathing, light meditation, or listen to calming music. Aim for 7 to 8 hours of sleep each night and avoid staying up late or having poor quality sleep. 6. Have regular health checkups. Even if your blood sugar seems stable, you should still go for checkups every 1 to 3 months, depending on your doctor's advice. Doctors will check your heart, kidneys, eyes, feet, cholesterol, HbA1c, and more. This allows timely adjustments to medication, diet, and exercise plans to prevent complications. By remembering and following these 6 principles daily, you can live healthily, minimize complications, and enjoy a fulfilling life with your loved ones. Dear viewers, Type 2 diabetes is a chronic disease, but it is not the end of a healthy life. With the right knowledge, proper actions, and a consistent healthy lifestyle, you can absolutely manage diabetes and live happily and actively every day. We hope today's video has helped you and your loved ones gain more knowledge to prevent, detect early, and manage this condition more effectively. If you found this video helpful, don't forget to click like and share it with family and friends, especially those who are middle-aged or elderly. And feel free to leave a comment below. Are you currently living with diabetes? What challenges are you facing in managing it? Share your thoughts. We're always here to listen and support you. Don't forget to subscribe to Holistic Health 24H and turn on the notification bell so you won't miss any of our weekly videos on senior health and wellness. Wishing you good health, peace of mind, and a fulfilling life, every single day.